weird. It's not letting you click.
We're sorry for the technical difficulties, everybody. Please just hang with us. There you go, Jessica. Do you think you have control now?
Yep.
Okay, sounds good. Well, thanks everybody for joining us. Again, my name is Kim Ryan, Director of Patient Information Services for Fight Colorectal Cancer. We're thrilled to have you all here with us today for our webinar called Take the Wheel, Healthy Lifestyle Changes that May Reduce the Risk of Colorectal Cancer, of your colorectal cancer recurrence. So a couple of housekeeping notes. Tonight's speaker is Jessica Iannotta, and she will go through some of her credentials with all of her initials after her name in just a second, and I will do a more formal introduction of her as well. But our archives, just so you know, our webinars are archived on our website. They're at fightcolorectalcancer.org/webinars. So if you know of somebody who wasn't able to tune in tonight that wants to, or today that wants to, you can refer them to that link there. We would like to send you a follow-up survey, so if you can take it just a few minutes and complete that, we would be sure and send you out one of our Blue Star of Hope pins. So we really appreciate your feedback on the webinar today. If you'd like to ask a question, although I do want to say we've gotten so many questions in advance, I don't know if we'll get to some questions tonight, but feel free and enter them in on the right-hand side of your screen, and if we don't get to them today, then we'll be sure and address those questions with Jessica tomorrow. And also, you can call our Fight Colorectal Cancer answer line at the number listed there if you have some questions that you want to ask that we didn't get to tonight. So I'm going to turn it over to Jessica, and before I do, just a little background on her. She is a registered dietitian and certified specialist in oncology nutrition. She studied nutrition at Cornell University and completed her dietetic internship at New York Presbyterian. She obtained her master's degree through the University of Medicine and Dentistry of New Jersey, and Jessica has worked in inpatient and outpatient oncology settings since 2001 and currently works part-time at the North Shore Montreux Cancer Center. Jessica is in charge of all operations, including clinical and culinary operations, ranging from menu development to evidence-based website content, relationships with registered dietitians and social workers, and developing processes and protocols for intake, management, and outcomes analysis of patients. So we're thrilled to have her expertise here with us today. And Jessica, I will let you take it away.
Okay, great. Thanks, Kim. And welcome, everybody. I'm really excited to be a part of this webinar today. When I actually first saw the title just now on my screen, I had a really great thought. And, you know, this webinar is titled Take the Wheel. So I want you to think of me today kind of as your co-pilot to help you take the wheel and take the reins and really optimize your nutrition for survivorship to keep yourself healthy and strong. And I'm going to give you some great tips today on how to do that. So some objectives that I foresee for our webinar today. When I often counsel colorectal cancer survivors, there are some basic things that I focus on. We do focus on symptom management because, of course, as you all know, many side effects often linger beyond treatment, and there's, you know, often getting in the way of optimizing your nutrition and making the most of what you're eating. And then we're also going to focus on some nutritional recommendations for survivorship, including things like, you know, red meat, how much should you eat, is it good, is it bad, weight management, all those burning questions that come to mind often for cancer survivors. And we'll also touch a little bit on some physical activity recommendations as well. So some of you may be pretty familiar with some of these statistics, but for those of you who haven't seen them in a while or may not be aware, colorectal cancer is actually the third most common cancer in the United States. And it's also the second most common cause of cancer death in the U.S., so definitely, you know, very prevalent. And what we've noticed is as obesity rates have increased, in fact, the number of cases of colorectal cancer has also increased as well. So we're going to touch on that a little bit later in terms of weight management and appropriate nutritional choices for that. Overall, though, there is good news. The evidence is showing us, though, that overall the incidence of colorectal cancer is decreasing. So we are making an impact with early screening and all the awareness that groups such as Fight Colorectal Cancer have been doing for colorectal cancer in the United States. Okay, so one of the most common side effects that patients often complain to me is fatigue. And the thing about fatigue is it can be so nebulous. Fatigue is just something where you may just have an overall tired feeling, or it may be extreme enough that, some days you really have trouble getting yourself up and moving. Believe it or not, fatigue can linger after cancer treatment for years. So it's definitely something that can get in the way of your daily activities, that can just make it harder overall to function and do the things that you want to do. One of the things I often recommend to kind of make an action plan for fatigue, because there's so many things that can contribute, there's a few different areas that we do focus on. First off, we want to try to include some physical activity, get some blood flow going through your body if you can, in the amount that's appropriate for you. Things like, even simple things, stretching, simple yoga movements, Tai Chi, even taking a nice brisk walk. Those are great ways to kind of enhance your energy level. Exercise has a natural way of combating fatigue and giving us actually more energy, despite the fact that we're expending energy during that process. It actually does help you feel more energized. It's also important to drink enough. Definitely, for sure, for those people who don't necessarily, you might not have the same thirst mechanism that you did before treatment. You don't realize that even mild dehydration contributes to that tired feeling. You may be really inclined to take a nap more often than you used to, but definitely avoid long naps. 20 to 30 minutes, power naps are great. Sometimes long naps can actually make you feel more tired because your body's kind of settled into that long sleep mode. And of course, when we're talking about nutrition today, adequate diet is, of course, of utmost importance in terms of fighting fatigue. Undernourishment, malnourishment, not eating enough calories, not eating the right kind of foods. People who tend to eat really high sugary foods, more energy dense, less nutrient dense foods, tend to experience more fatigue because they get more larger swings in their blood sugar and things that don't necessarily contribute to giving them adequate energy during the day. So we'll go into some more details about this throughout the presentation. I also often get asked whether or not it's appropriate to take a vitamin or a mineral supplement to fight fatigue. Obviously, that's a discussion for you, your dietitian, and your medical team. But in general, I often find that the suggestions that I mentioned first are the ones that contribute most in terms of helping fight fatigue. Not everyone really needs a vitamin or mineral depending on how their diet is and what may be appropriate for you. But definitely important not to go overboard, saying, okay, well, I'm tired, then I need a high-dose vitamin B complex, and that's going to make me feel better, and that's definitely not the answer. So that's kind of the point I'm trying to make, is focus on your diet, your exercise habits, your sleep habits, your stress habits. Those are more important than anything in trying to combat the fatigue. So the second most common side effect that I talk to patients about is constipation. And this is actually kind of probably, in addition to fatigue, another really complicated symptom because there are so many factors that can contribute to it. First off, you can have decreased motility of your digestive system as a result of the treatment and as a result of many of the medications that you take. Many medications slow down the digestive tract. Antidepressants, opioids, which are pain medications, sleep medications, those all can have negative consequences on your bowel movements. Once again, if you're somebody who's not a big drinker, even mild dehydration, inadequate fluids, inadequate fiber can definitely contribute to constipation. Inactivity, for sure, because physical activity gets the bowels moving and helps keep your digestive system regular. And of course, just side effects of the cancer treatment and cancer itself, of course, can cause lingering constipation. So what do we do to combat it? Well, first off and foremost, make sure you're drinking enough because your body needs that lubrication to help the stool evacuate appropriately and help your body to also be regular so that you don't get backed up, per se. If you think of it just kind of like your plumbing, you need lubrication to help everything move through appropriately. And also, not only fluid, you need weight. And what adds weight to your stool? Dietary fiber. So fiber intake is also very important. We're going to go through some good sources in a moment. Physical activity, like I said, gets the bowels moving, helps promote regularity. And even some people find kind of things like prune juice or prunes, even, some probiotics have helped people provide regularity. So you kind of get a niche for what works for you. And this is where a registered dietitian would come in handy in terms of helping you to identify the exact type of foods and dietary regimen that would be appropriate for you and your history. Encourage people, and we'll talk about this for a few different symptoms, I encourage people to use a food diary. Sometimes that's helpful to identify areas where you may need some improvement, or you may even identify, okay, this is actually helping me. So sometimes what we'll spot on a food diary is sometimes people are eating something that they crave, but in large amounts, sometimes those foods can also bind and slow down the bowel movements. So when we're talking about good sources of dietary fiber, obviously plant foods are great sources. So fruits, vegetables, grains, beans, legumes, nuts. Oh, and I'm sorry, there's an L missing from vegetables. Well, you all know what that is. So we got our fruits and our vegetables. So find unique ways to fit in dietary fiber, whether it's snacking on a piece of fruit, having a fruit salad, having a side salad with your meal, or if you can tolerate salads. If you don't tolerate cooked vegetables, even canned soft vegetables, smoothies, well-cooked vegetables still count toward dietary fiber. When you in terms of your grains, obviously you always want to choose whole grains instead of refined grains, things like whole wheat rather than refined flours, beans and legumes, nuts. Those are great to add to soups and stews and salads, and nuts you can add on top of yogurt and add great dietary fiber, and you don't need to add a lot of them to make a good difference. Fiber supplements are only necessary for people who aren't able to get in these other foods or have a reason why dietary fiber may be more difficult. And as I mentioned before, anytime we're talking that word supplement, it's always important to discuss with your dietitian and medical team to find what may be appropriate for you and if that's necessary. And once again, anytime you're adding dietary fiber, always be sure to consume adequate fluids, because you need that lubrication. You're adding more fiber. You want to make sure that it can work the way it's supposed to and move through your digestive tract. So another common side effect is a partial bowel obstruction. So depending on the type of cancer treatment that you've had, something that you may be living with is a part of your bowel that may still be obstructed, whether it's scar tissue or some other area of the way a surgery was done where you're more prone to getting a bowel obstruction. And in that case, you may need to concentrate on fiber in a different light. So instead of choosing very high fiber foods, you may need to keep that more moderate. We actually call this a low fiber or low residue diet. So when you're looking at dietary fiber on a food label, you want to actually keep that to a minimum. So for those who are choosing high fiber, they may be going for 5 grams or more, which is generally what we aim for on a food label. But for someone with a bowel obstruction, you'd aim for 2 grams or less. Excuse me. We also want to avoid gas-producing foods, things like cruciferous vegetables, onions, melons, carbonated drinks, things that can really cause more bloating, because this can certainly make a bowel obstruction much worse and much, much more uncomfortable. Adequate fluid intake is very important, as we've mentioned all throughout all of the symptoms that we've been talking about today, and increasing physical activity as well. Sometimes stool softeners, laxatives, different medications prescribed by your medical team can also aid in preventing bowel obstruction, and that would be appropriate to discuss with them. So when we're talking about diarrhea, it's very important to talk to your physician, because diarrhea, as we've discussed with other symptoms, also has multiple factors that can contribute. You want to discuss laxatives and stool softeners that you may no longer need. You might also want to look at your diet and look at the type of fibers that you're eating. Sometimes diarrhea can be due to an infection. So if that's the case, often your doctor may actually want you to do something like a clear liquid diet in order to prevent, allow the bowel to heal, get rid of the infection, and not irritate it with further food. it is important, and most importantly, it is important to replace the fluid that you're losing with the diarrhea. And I'm sorry if I have a little, from the talking, my voice a little bit, but I'm going to get this through. So replace each loose stool with 1 cup of liquid. That can be things like Gatorade, which is a sports drink that has extra electrolytes in it. It can include broth or diluted juices as well. Small, frequent meals is also a really helpful tactic for diarrhea. And the reason for this is that you're eating a little bit throughout the day, so you're not overwhelming the digestive system and increasing the amount of bowel movements that are contributing to that uncomfortable feeling. Soluble fiber is very helpful because it helps to bind the stool. So things like banana, apples, oatmeal, all are great soluble fibers that help the body to bind up that diarrhea, make it more comfortable, and decrease the amount of bowel movements that you're having. You also want to limit dairy products if you're somebody who's already sensitive to lactose. Caffeine can also irritate diarrhea as well. Sometimes you may be somebody who's experiencing chronic diarrhea. This can also be a side effect of cancer treatment that may last for quite some time. In this case, all of the above suggestions are important, but you may actually need additional probiotics to restore the digestive balance. You may also need an over-the-counter or prescription medication that would be appropriate to discuss with your doctor to manage that chronic diarrhea. So gas and bloating. We talked about this a little bit when we were talking about bowel obstruction. Gas-producing foods like the beans and legumes and cruciferous vegetables can often make gas and bloating much worse. You may be experiencing gas and bloating because of changes in your digestion. You know, your bowel movements may be functioning a little bit more slowly. So if that's the case, it's very important to be aware of your diet. So whenever I have a patient who's experiencing gas and bloating, automatically we'll use a food diary to help identify foods that may be contributing to this. Excuse me. There's also other things that contribute beyond foods. Carbonated beverages, drinking through a straw, believe it or not, even chewing gum can actually cause more air to be swallowed and contribute to gas and bloating. Daily probiotics are a great remedy for gas and bloating, especially if your body is already deficient in the proper digestive balance. You can find it in foods like kefir, yogurt, sometimes even a supplement is appropriate, and you can discuss that with your medical team. Over-the-counter meds, Gas-X, Beano, sometimes those are also helpful, and that would also be a great thing to discuss with your registered dietitian to see where and when that would be helpful for you. Excuse me. Other options include things like peppermint oil, fennel, ginger, parsley. These are herbs and spices that can be added to your foods that definitely help the digestive system to dispel gas and allow the buildup to be a lot less, and obviously helping to keep you more comfortable. So those kind of more natural things that you can add to your foods to help as well. So another side effect, before we get into kind of our recommendations on ways you can change your diet, very important that we address weight changes. Many cancer patients after treatment will experience weight loss or have experienced weight loss. They may experience weight gain as well, so sometimes it can be either side of the coin. For those who have experienced weight loss, definitely important to meet with a registered dietitian and make a good nutrition plan, because chances are you may need an oral nutrition supplement, let's say a shake like an Ensure Boost or something like that. There's so many thousands of supplements like that on the market, and you can find one that works for you. They even come in clear liquid versions. They come in powders. There's all sorts of great supplements that can help add extra calories and proteins to your diet and help to promote more calories and help to manage that weight loss. Small, frequent meals is of utmost importance. It's actually one of the best strategies that as a cancer survivor you can do, not only for weight management, but just to kind of help your digestion work more appropriately by just giving your body a little bit at a time. So high-calorie snacks, things like peanut butter, cheese and crackers, yogurts, yogurt smoothies, shakes, are a great thing to add in terms of weight management to help add extra calories and protein. And another really important thing to consider is not to make it stressful. So if somebody is experiencing weight loss or trying to gain back weight that they've lost after treatment, what we want to do is we don't want to add stress to the situation. We want to make eating pleasant. We want to keep it calm, and we want to encourage gently to help make it not so challenging. So that's actually really important to kind of not put so much stress on the situation, but yet have an action plan, have something that you're going to work on, and build slowly. Try different snacks, try different supplements, talk to your team, and follow up, get the support that you need. For those who've experienced weight gain, and it's interesting because I kind of put that thought in there, a lot of times a cancer patient that I've talked to who, let's say, doesn't lose weight, wanted to lose weight, or their weight actually went up more than they wanted it to, kind of like speaks to the fact that not all cancer patients lose weight during treatment. And that's actually a good thing, because we may not, obviously weight loss, we don't want you to lose weight or too much weight that is unhealthy. So for those who have experienced weight gain, we're going to talk about a few more strategies a little bit later on in the presentation. Definitely encouraging physical activity, keep moving to expend energy, and also to decrease the high-calorie foods, the calorie-laden, energy-dense foods that are contributing to more calories, obviously, than you need, and choosing more healthy plant-based foods, which we're going to talk about some great examples later on. Okay, so now that we've talked about some lingering side effects and symptoms that cancer survivors often experience, now we really want to get into the nuts and bolts. How can we prevent recurrence? What can we do, and how can we make a manageable plan? Believe it or not, there are many things that we can control. The risk factors for colorectal cancer, and I have a great slide at the end of the presentation that I'm going to kind of recap this. Increased body weight, inactivity, diets that are high in red meats like beef, pork, and lamb, processed meats, alcohol intake, and age. So as you see, many of these things we have control over, and we can make some good changes that make a true impact. So when we're talking about red meat and processed meat, why does this all talk about red meat? And it's actually pretty simple. Red meat has what's called heme iron. It's actually the best form of iron, but unfortunately in large amounts, it damages the lining of the colon. So people who tend to eat a lot of red meat, eat less plant-based foods, are exposed to more of this heme iron. The American Institute for Cancer Research recommends that you limit your red meat to less than 18 ounces per week. So I don't know, for some of you that number may sound like a lot, and that's okay because you don't need to eat 18 ounces a week. And for some of you, you may be thinking, wow, I really need to cut down. So you need to use that guide appropriately. You think of a serving as, typically it's 3 ounces or the size of the palm of your hand. So, even if you think of a serving, that's still 6 servings, and that may be way more than something that is appropriate for you and the type of diet you're looking to follow. But what I want to point out is this number is what's been shown in the research. So the American Institute for Cancer Research looks at all the studies that have been done with cancer, colorectal cancer, red meat, and what they found is those that ate 18 ounces or less were the ones that had that protection. And 18 ounces or more, there was the link to increased risk. You want to also avoid processed meats. Things, deli meats, things that we get on our sandwiches, deli meats, bologna, salami. Those are all smoked, cured, or salted. They have preservatives. All of those can create carcinogens. And a lot of times we prepare our meats on a grill as well. Those can create pretty dangerous chemicals, heterocyclic compounds, polycyclic aromatic hydrocarbons. You don't necessarily need to remember those words, just knowing that there are chemicals that are created in the grilling process that can also increase, the reason why red meats and grilling and things like that are dangerous in terms of cancer prevention. Also, foods like hot dogs, things that come along with a lot of nitrates can have nitrosamines, which also can contribute to the carcinogenic effect. We have found that calcium, and I know you've probably heard calcium is important to have adequate calcium as a colorectal cancer survivor. And the reason for that is that calcium, also things like vitamin E, can actually help to reduce some of these effects. Doesn't mean that it's still okay to eat them all the time, but obviously just kind of pointing out why the importance of good nutrition is really key. So how can we be smart about meat consumption? Well, we talked about grilling. So there are ways to reduce the amount of PHAs and HCAs. Marinating meats is a really great way to reduce the amount of those chemicals leaching into the meat itself. So marinating a chicken breast or something, let's say fish, that you're going to put on the grill is a great way to enjoy grilling, but in a safer way. It's also helpful to cook at lower temperatures. So kind of low and slow is a great way to grill because it also reduces those chemicals as well. Include more cruciferous vegetables. Include the vegetables that have those compounds that are helpful in cancer fighting, of course, is always key. Replace your red meat also with other really healthy lean proteins, things like fish, chicken, turkey, dairy, beans, tofu, nuts. All are much healthier proteins that can replace red meat in a lot of your meals. If you do enjoy red meat once in a while, certainly there are leaner cuts as well. So things like sirloin, any loin or round cut, like filet mignon, is a great leaner cut, doesn't have as much saturated fat. And then also think about the sandwiches. Think about delis and lunch items. There are some really much healthier choices that you can choose. There's things like nut butters, hummus, chicken salad, egg salad that you can use. You can even use low-fat mayonnaise, low-fat cheese. There's ways to make a healthier sandwich, definitely, rather than always having to rely on the good old standard turkey. I mean, you could even make your own homemade turkey breast. Really easy. Buy turkey breast in the supermarket, roast it at 375 in your oven, slice it up, and you have your own homemade turkey breast without having to get it from the deli. Okay, so we've mentioned a lot about weight already today. And kind of to point out and hit home some of the key points here, it's actually, after we kind of consider smoking, a healthy weight is the most important thing that you can do for overall cancer prevention. And in fact, in adult life, it appears that it can also increase risk for colorectal cancer. Even more importantly, for people who tend to gain weight in their abdominal area, which tends to happen as we get older, our bodies tend to deposit weight more in our abdominal area, which is considered more of our apple shape. This is the kind of weight that's the most dangerous. And the reason for that is that it increases pro-inflammatory factors kind of in our body by having weight and adipose tissue in our abdominal region. So that's even more important why that kind of weight gain and trying to prevent it is very important. Controlling weight, now we all know watching our portion sizes, increasing our fiber, avoiding high-calorie foods, physical activity. Everybody knows those are the things you need to do, to prevent weight gain and maintain a healthy weight. Those things, it's easier said than done. And I understand that as a dietitian, and I've counseled so many people in that scenario. And I think the key factor is obviously recognizing that those are the things we need to do, but finding a way to stay motivated. So belonging to a support group or joining in with some friends, there's so many different ways that you can stay motivated, especially as a cancer survivor, because it's the one thing you can do to take control of your nutrition and take control of your life and prevent a recurrence. And the key is really in your hands, right? So by making some good, positive changes, you can make a really big difference. So when it comes to dietary fiber, which we talked a lot about earlier in terms of managing both diarrhea and constipation in different forms, there is also convincing evidence that dietary fiber is important for decreasing your risk. For every 10 grams of fiber consumed, it can decrease risk by 10%. So the recommendation for dietary fiber is 25 to 35 grams per day. That's approximately 25 grams for an average-sized woman, 35 to 38 grams for an average-sized man. Now, it sounds like a lot, but if you're implementing the foods that we're talking about, fruits, vegetables, grains, and trying to add more of those, It's actually not hard to achieve that number at all. The average American eats about 10 grams a day, which is less than half of those amounts, but that's with a diet that's not high in fiber by any means. So by adding good choices, whole grains, beans, nuts, legumes, fruits, vegetables, you can easily achieve the goals that are set. We've mentioned a little bit about different kinds of fiber that help both diarrhea and constipation. So the soluble and insoluble fiber are the two different kinds that benefit our bodies. The type that's truly linked to decreased risk of colon cancer is more of the insoluble fiber. That's the true roughage. So it's the outer skins of your fruits and vegetables and the true grains in your bread, cereals, and pastas. The insoluble fiber, that roughage, is what adds weight to your stool, increases the transit time of the stool through the bowel, so there's less chance that if there's toxins in that stool, by increasing transit time, there's less exposure to the walls of your digestive system and your colon. Also, by increasing that transit time, you're also removing potential harmful substances from the digestive system, harmful substances, toxins, and you're getting it out of your system as quickly as possible. So that's why insoluble fiber is so important. Soluble fiber is also very valuable. It doesn't add as much weight. What soluble fiber does, and we've discussed this when we were mentioning diarrhea, soluble fiber actually helps to form a gel with the water and the liquid in your stool. So it does have that nature to kind of bind stool. Soluble fibers, like the kind in an apple. The apple contains pectin, which is a type of soluble fiber. And that, in fact, helps to lower cholesterol. So because of that binding nature, it can also bind and help to lower cholesterol from being absorbed from the GI tract. The key with dietary fiber is, obviously we all know it's important, but you don't want to go kind of overnight and double or triple your fiber intake, because then, like we mentioned, you are going to experience constipation. So the key is to introduce it slowly, make sure you're drinking plenty of fluids, and find unique and fun ways to add, new sources of dietary fiber to your diet, whether it's changing your morning breakfast cereal or starting to have a salad more times during the week for lunch or as a side dish to a meal. There are definitely some easy ways that you can make a good start. So garlic and cruciferous vegetables have also gotten attention when it comes to colorectal cancer prevention. So garlic may be protective, and the reason for that is that we all think of garlic as a white food. We tend to think of protection from colorful plant foods, but believe it or not, white foods also have helpful anti-cancer phytochemicals. So garlic contains things like quercetin, allicin, allicin, they're called the allyl compounds. And these actually also have really helpful anti-cancer benefits, specifically that we've noticed for colorectal cancer. Cruciferous vegetables, we mentioned those before, the broccoli, the cauliflower, the cabbage and things like that. These are, in fact, also linked, more closely to certain kinds of cancers and are of particular significance for colorectal cancer. They're high in antioxidants. They also have the good fiber that we talked about in addition to folate. They also have anti-inflammatory properties. And, they're a great thing to consider adding as long as you're not somebody who's too prone to gas or bloating. It's always a good way, if you're somebody that tends to eat broccoli or Brussels sprouts and, you just say, those aren't even foods I can have because they cause me so much bloating, you might want to talk to your doctor and dietitian about that BINO that I mentioned that contains an enzyme that helps the body to digest some of those indigestible fibers and cruciferous vegetables. So that's an option for you so that you can still get the health benefits. So kind of when we're trying to summarize some of these nutritional recommendations that we've been discussing, most importantly, I think the takeaway message is you want to focus on the big picture. So we don't want to look for the one miracle food or the quick fix that's going to make an impact and cure cancer, because unfortunately, and I wish it was that easy, but unfortunately that's not the case. It's really looking at the whole picture and trying to make small changes that can, over time, make a big impact. Keeping a healthy weight, eating a plant-based diet, and we're going to actually give you a few more tips on that in a moment. Avoiding the processed meats, limiting red meat, avoiding the energy-dense foods, the foods full of, sugars and fats and things that we don't need. avoiding supplements as a protection from cancer, and I've mentioned that a few times as well, that, that's kind of always a last resort. Diet is always the first vehicle for, your nutrients and your antioxidants. Limiting your alcohol consumption. For a man, you should have no more than 2 servings a day, and for a woman, no more than 1 serving a day. And a serving is 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of hard liquor. And also the importance of physical activity in terms of decreasing cancer risk. So that mostly plant-based diet. A great analogy I like to use when I talk about a plant-based diet is if you think of your body like a nice, clean, tailored white shirt, and you get a stain on that shirt, you'd want to launder it right away to avoid ruining your shirt and the stain setting in. So we think of antioxidants and phytochemicals in our diet. That's actually our body's detergent, our body's way of cleansing our body from carcinogens, neutralizing free radicals, and protecting our body from potential cancer-causing compounds. So how do we do that? We increase our fruit and vegetable consumption. Usually I tell people to aim for at least 7 to 9 servings per day. It may sound like a lot, but once again, you start slowly, make small goals. 1 serving is half a cup of most fruits chopped, or a small piece. So most of the bananas that you find sitting on the supermarket shelves, believe it or not, are probably at least 2 servings. So it's actually not difficult to get in, if you pay attention and you make that your goal. And you want to aim for the rainbow. So choose a lot of different colors of fruits and vegetables to get in a variety of good antioxidants and phytonutrients. As we mentioned, the whole grains, the dietary fiber is important, but whole grains also have antioxidant properties. You want to make at least half of your grains whole. So, trying to look for 100% whole wheat to be at the top of the list when you're looking at the ingredient list, because a lot of times they may say whole wheat, but it's not 100% whole wheat. In that case, it really only needs to have 50%. So you're not necessarily getting a lot of fiber from that food. So read the food label, look at the dietary fiber on the product, and make sure you're getting a good source. The beans, lentils, legumes, also great plant foods, great part of a plant-based diet. And they're also a great alternative to that red meat. So if you're looking to cut down, these are a great source of protein. They're obviously a lot lower in fat. They're great, versatile. They can be added to a lot of different kinds of recipes, and can be really quite tasty if you find some fun and exciting recipes to try. When we talk about plant-based diet, the American Institute for Cancer Research actually calls it the new American plate, where we think of the old American plate where it's the slab of meat and then the side of rice and vegetables. The new American plate, meat is actually the side dish. The vegetables and the grain are the main dish, and the meat should be 1/3 of your plate or less. We want to avoid the sugary beverages. We want to avoid things that are empty calories, like we've been mentioning throughout the presentation, because they're not nutrient dense. They're not giving our body any added benefit. So if you're really somebody who has a hard time drinking just plain water, but you need to stay hydrated, why not try flavoring your beverages with fruits, vegetables, herbs? I think a great way, and I tell my patients this all the time, you take a pitcher of water and you slice some green apples, some lemon, some lime, and you just let it soak in the water, and you can use the pitcher throughout the day, and it gives it a really, really great flavor. Not too strong, but just enough to make the water much more palatable and easy to drink. So we did touch on physical activity a little bit throughout the presentation in terms of its benefits for fatigue and constipation, but there actually are some recommendations as well for cancer prevention and survivorship. So the American College of Sports Medicine recommends that cancer survivors aim for at least 150 minutes per week of moderate to vigorous exercise. So once again, this number does sound like a lot, and I think we're putting it in terms of minutes. But if you break it down over the course of the week, and even if you do exercises in let's say 10 or 20-minute bouts, if you're aiming to do a little bit every day, it's actually not that difficult to get, slowly over time, get to that number and make it part of your routine. Exercise, obviously cardiovascular exercise, moving to get your heart pumping and the blood flowing is important, but strength training and helping to maintain your muscle mass is of equal importance, and a lot of times it doesn't get as much recognition as it should. At least 2 times per week is what we recommend for strength training. Now, if you're somebody who's just finished cancer treatment, it's important to discuss any new exercise regimen, obviously, with your medical team, to make sure that they approve that it's safe for you to start something new. But that's even more important with strength training because you're obviously going to be lifting and building muscle, and you want to make sure that that's a good time for you to start something like that. And you also want to do it under the appropriate guidance. So you wouldn't want to just go and just kind of start doing something like that on your own. What you would want to do is make sure that you get, trusted information from a professional on how to slowly add something like that to your exercise regimen. Stretching is important too, and don't ever underestimate the importance of stretching, especially if you're getting back into the groove, getting back into your exercise regimen. You want to take real care to make sure and, take it slow, stretch nicely and slowly before you exercise so that you prevent any unnecessary injury or fatigue or muscle fatigue, and you take better care to do it the right way. Obviously, there's certain cautions. So people that have any kind of morbid obesity, any kind of lymphedema involving your limbs can potentially make exercise obviously a little bit more difficult and challenging. So in that sense, we do obviously recommend that you seek the appropriate recommendations from your healthcare team. Always recommend, as everything else I've mentioned today, when you're making new goals, it's always important to start slowly, and that's obviously additionally important with physical activity. You start with light intensity, you progress slowly. You allow your symptoms to be the guide, meaning if you're progressing slowly and starting with just a walk 3 times a week, but you're starting to feel better, that's great because that means you're making a difference, and the physical activity is actually, helping you, and that you can maybe start to even include a little bit more. So you start slow, and most important, you listen to your body. So this is a slide I was mentioning that I was going to present to you at the end here, and I think this slide is also from the American Institute for Cancer Research, and I think this slide really, really speaks volumes because we've talked about the importance of staying a healthy weight, moving more, fiber-rich food, limiting red meats, avoiding alcohol, and then you see it very clearly right here how many colorectal cancers can potentially be prevented with these factors, and it's actually half. So, and that's great news for you as a survivor. There's so many positive changes that you can make, so many things you can do to stay healthy and prevent a recurrence and feel your best. So engage your family members, engage your friends, engage your loved ones, engage your medical team to create a survivorship plan. Make some of these things that we've talked about today some of your goals to try and optimize your nutrition, get some activity in there, add some real good cancer-fighting foods so that you can make a real impact. So I think that it's important, we've talked about a lot of information today, but it's also important to kind of know where to go for appropriate resources. So in terms of exercise, the Livestrong Foundation actually has survivorship exercise programs through many local YMCAs. So that's a great place to look if you're looking to get started and you need good oversight, a good, and a good regimen that's been kind of done and performed in the cancer survivor population specifically. Obviously, referrals to a registered dietitian is important.
Unmuted.
An oncology dietitian is even more important because I myself am an oncology dietitian with a board certification in oncology. So a registered dietitian who has this certification has the additional credential to demonstrate that they have years of oncology experience with which to help further guide you and give you the appropriate recommendations that you need. There's actually a link. So Meals to Heal is currently the company that I'm working with where we provide fresh, healthy, home-delivered meals for cancer patients and cancer survivors. We have access to registered dietitians who actually provide nutritional coaching from the comfort of your own home through the telephone. And we have links to help you find a dietitian in your area if you need to find somebody in person. So there's a ton of great resources on our site, and I definitely encourage you to go to our site. The website is actually meals-to-heal.com, or you can easily do a search and find us through Google. There's also the American Institute for Cancer Research. They have something called we talked about the New American Plate, where meat is the side dish. So they have a great challenge where you can become part of the New American Plate Challenge. and you get free cancer-specific info. You get motivational emails. There is even a component of kind of engaging with a dietitian as well through that New American Plate Challenge. And then, of course, the wonderful and fabulous resources through Kim and the folks at Fight Colorectal Cancer. Definitely take advantage of all the great resources and the great monthly webinars that they offer, because that can help you stay engaged in a community that can keep you motivated and help you to maintain your goals. So I hope that you've learned a lot in the presentation today. I definitely look forward to your questions. And as Kim mentioned, if there's a question that's not answered, obviously there's, we anticipate there will be a lot. Certainly feel free to email her, and we'll be happy to try to get you an answer even after the presentation, if that would be helpful to you.
Great, Jessica. Thank you so much. Yeah, we've gotten a lot of questions actually before the webinar, so we're going to try and get to those in the next 10 minutes here. But I guess I wanted to kind of kick off the Q&A with, there was a lot of information that you presented today that's great information for cancer patients to know. So from your perspective, why is nutrition information not a bigger part of a treatment plan with doctors and chemo treatments?
That's a great question, Kim. And I think one of the main limitations, registered dietitians, unfortunately, are not processed through health insurance. So we're not reimbursable. So unfortunately, in today's cancer centers and hospitals, we're kind of, when the bottom line is impacted, unfortunately, the dietitians don't generate additional revenue to those services. So a lot of times, it's more limited in terms of the amount of dietitian representation that, let's say, a cancer hospital or a cancer center can fit into their budget. So it's challenging for you, the patient, because you may be talking to the physician and he refers you to the dietitian, but in that case, there's only maybe 1 or 2 dietitians for your cancer center, and it may be hard to get an appointment. Another aspect too is that a lot of times the physician themselves, they're so focused on getting you the right treatment plan and doing what they need to do to help you, get rid of your cancer, that sometimes nutrition doesn't come up in their mind right away. And that's not necessarily a bad thing, because they're doing their job. So a lot of times it's important to kind of, you have to be proactive and always kind of seek out what you need. So if you're somebody who didn't get the chance to meet with a dietitian during chemotherapy or to create a survivorship plan, it's never too late. Like I said, there's different forms where you can seek the assistance of a registered dietitian. At Meals to Heal, we have a form where you can actually connect with somebody through a telephone and not have to make an appointment. But every cancer center, and most cancer centers, have at least some representation of a nutrition team on their staff. It may only be somebody there 1 or 2 days a week. You may have to wait a little bit while for an appointment, but that's always another route to go as well. A lot of times cancer centers are now having survivorship teams and survivorship programs, so that's another great way to connect with a team that can direct you to the appropriate nutritionist, dietitian that's working with that center. So I know it can be challenging. We're happy, if you call us, we're happy to help you locate somebody in your area. We actually have a link on our website as well, where you can search by zip code for an oncology dietitian across the country. So, we'd be happy to help connect you with someone if that's something that's been a little bit more difficult for you.
Okay, great. So whether you're in treatment or you've just finished treatment, it's not unheard of for you to go to your healthcare team and be like, is there a nutritionist or a dietitian that I can talk to? So that's good to know. Do you know, is there anything, still kind of along those lines, are there any advancements that you know of kind of being made to bring those two very important resources on the continuum closer together?
Oh, absolutely. Yeah. I mean, even since obviously I've been working in the field for 12 years, and even in that time, I think the oncology nutrition certification has made a big difference. So now that there's an oncology certified dietitian, a lot of cancer centers are recognizing, okay, this is a really valuable resource, and we can't go without that in our cancer center, because we make a difference in outcomes. So when a cancer center is looking at the research and they're saying, wow, this nutritional intervention is really helping the patient to reduce their symptoms, to feel better, to combat their fatigue, to help them stay healthy during survivorship. And the proof is the proof's in the pudding, so to speak. And I think as people are seeing that, more and more people are really taking the reins and bringing on as much nutrition services as they can possibly offer within the scope of what their cancer and their system can do. So it's definitely promising. We're moving in the right direction.
Okay, well, that's certainly good to hear. You had talked a little bit in your presentation about sugar and like sugary drinks. Is there actual formalized data that's available on the relationship between sugar and cancer?
Yeah, and I'm glad you asked this question because it's definitely probably one of the #1 questions I get asked. And the thing about sugar and cancer is, okay, sugar is our simple carbohydrate. So everything that we eat is broken down into simple sugars. If you think of it like you eat a piece of white bread and you let it sit on your tongue, it starts to dissolve, right? Because the amylase, the saliva has enzymes that even begin to break it down in your mouth. So that simple sugar is feeding every cell in your body. It's not necessarily just focusing on that cancer cell. So the key is that when people look for a link between sugar and cancer, they're looking kind of for an answer, for a quick fix. But really when we're telling you to avoid too many sugars, it's not because we're telling you sugar is going to directly feed the cancer. What we're trying to tell you is that a very high sugar diet promotes a cancer-friendly environment in your body. So if you're somebody who eats a lot of sugary drinks, a lot of cookies, cakes, candies, sodas, all of those are creating a lot of insulin, which is a hormone that your body needs to get that sugar into your cell. So when there's a lot of insulin being produced in your body to help get the sugar into your cells, that creates a more cancer-friendly environment in your body. So that's the difference, really. It's that we want you to avoid too much sugar, too much energy-dense food, so that you focus more on the nutrient-dense food, the foods that are going to help your body to fight the cancer, help your body to stay strong and fight disease, and have those antioxidant and really, really cancer-fighting properties. So it's really, when we say watch your sugar intake, don't go overboard, it's really kind of what we're trying to say is eat more healthfully, and that's really what it comes down to. It's like the basic concept that, this is what we know we need to do, and here's how we do it. This is one of the steps that we take.
Okay, great. And along the line, so colorectal cancer, because of some of the advancements within the field, we're finding that patients are living longer and longer and longer with colorectal cancer, and some of them are actually dealing with it as a chronic type of cancer. So if you think about a patient like that who's in a long-term chemotherapy treatment with really like a limited stomachable palate, what do you suggest to them in terms of nutrition?
Yeah, and that's actually, a situation that I see quite often, for sure, and it's challenging. I think most importantly, as we mentioned earlier, it's important to seek the assistance of a registered dietitian, because what we can do, we can look at what you're already eating and help to give you suggestions and get to know you. So what a dietitian is going to do is going to get to know you as the individual. What can you tolerate? What can't you tolerate? And based on that realm and that scope of what we can see fits well for you and how you feel and your symptoms, we can help you to optimize and maximize your nutrition. So a lot of times for those patients, obviously the key is really small, frequent meals. I know that your palate isn't the same. You're not desiring. You don't even necessarily feel hungry all the time, and that's actually very normal. But that small, frequent meals is key, because if you get into that habit of eating frequently throughout the day, whether you're hungry or not, you want to just keep a little bit of food into your system. That's definitely going to help you feel better, and it's going to help, believe it or not, reduce a lot of those symptoms, the fatigue, the nausea, the diarrhea, the constipation. That will help manage all those things. So it's very, very important to eat small, frequent meals and snacks. And then look at the nutrient-dense snacks. I think sometimes we underestimate the importance of those snacks. So trying to find a good nutrient-dense snack that's palatable for you, but that you tolerate, and that adds a good amount of calories, a good amount of protein. So maybe it might be a shake, whether it's homemade or store-bought. It may be cheese and crackers or peanut butter or almond butter on a piece of whole wheat toast. Doesn't need to be difficult or extravagant, but just that simple snack in between a meal is also going to make a difference, help you get more calories, help you to maintain your weight, and also help your digestive system, like I said, to kind of stay on track. So you don't want to have large fluctuations, large amounts of time between eating, because obviously we're targeting your digestive system if you're on chronic chemotherapy, and it's taken a lot. It's taken a beating, right? So we want to be as gentle as possible, little bits at a time, kind of like a newborn baby. We feed them very frequently throughout the day, so it's a really important strategy to remember.
That's great. No, I like the analogy. What about some of those like boost drinks, some of the nutrition drinks? Where do you come down on that?
And that's, once again, that's all individual. So there's so much, like I said, there's so many different kinds out there now. From when I first started to, in the past 10 years, there's an organic supplement like Orgain now. There's so many different kinds that really I individualize it to the person, and oftentimes it's through trial and error. So they may try Boost, they may try like an Ensure Clear. That a lot of times we get samples. Most of the dietitians will have a sample for you to try, and we just experiment and find one that works for you, because many of them have similar benefits. They have added calories, added protein. They have some, maybe 25% of the micronutrients that you need if your appetite is really poor. But the thing is that's based on your level of tolerance and what works for you. So I would suggest maybe seeking out the dietitian, seeing if they have a sample program, trying out a few of them, because they all have benefit, but it really depends on what you tolerate.
Okay, great. I should have asked this question back when we were talking a little bit about the relationship between sugar and cancer, but can you touch a little bit on the artificial sweeteners like Equal and Splenda? How do they kind of relate to sugar, and then also to a relationship to cancer?
Yeah, that's another good question too. And and unfortunately, we don't have a clear piece of evidence that says for sure if you're somebody that uses artificial sweeteners every day or a little bit here and there, whether or not that makes a huge difference. Because the thing is that these things are considered safe by the FDA in the humanly consumable amounts. So the cancer properties, or if there are any, chances are they're in drastically large quantities that we would never even humanly be able to consume. So you want to remember that. Like if you're seeing that on a headline or reading that somewhere, it's probably based in an animal study where they've been given a whole lot, more than we could ever do. But it does still bring it back to that point. Even if though it's an artificial sweetener, the same point I made earlier, it's still not a required nutrient. So it really depends on what you need. If you're somebody looking to manage weight and you're a sugar addict and you need to just have something sweet but not have the calories, you and your dietitian may decide those things are appropriate for you for that time in your nutrition plan. But I'm always a big fan. If you could find a healthy replacement, whether it's real sugar or artificial sugar, I would go for it. I would use honey. I would use agave nectar. I would use fruit. I would use something that comes from the earth rather than something that's man-made or chemical, just because that's always the best decision, whether or not we have a piece of evidence or not, or we know the exact amount that's good, we know the exact amount that's bad. I think the bottom line comes down to, if you can try to find a healthier alternative, that's always the best answer for a cancer survivor.
Okay, I'm going to actually try and squeeze in just a couple more questions, but before I get to the last two, I did want to let folks on the line know that we have gotten so many questions about ostomies and ileostomies and diets as it relates to those that we need to do a completely separate webinar on them. And we've actually, Jessica has offered to do that for us. So we're not going to address them because there's just so many that we actually want to address the topic in general as a complete webinar. So stay tuned, and we will be sure and let folks know when the webinar regarding ostomies and ostomy nutrition is going to be available. So just a couple of last thoughts, or a couple last questions. Talk just for a second about organic foods. Like what do we mean when we say something that is organic, and is that actually better for cancer patients than regular foods, so to say?
Yeah, another really great question. And I always like to start off the answer to that question with recognizing the importance that whether a food is organic or not, the benefit of a fruit and vegetable greater outweighs any potential risk to a pesticide residue. So organic foods, they're great. They're healthy, and chances are they may even have, some more nutrients because of the way that they've been protected in the organic raising process, which is great, but they're a lot more expensive. And if you're a cancer survivor on a limited budget and you can't afford to eat organic, and there are obviously medications and other things that are a lot more important for your budget right now, that's okay. You don't have to feel like you're doing something wrong if you're eating a non-organic fruit and vegetable, because that's going to have a benefit to you no matter what, whether it's organic or not. I think the one important fact to remember when it comes to organic is that it is a little bit of a fad. I mean, there are certain things that are organic where they should be organic, but it's definitely more of a kind of a popular thing in our culture and in our food business right now. So if you are going to buy organic, spend it wisely on something that should be organic. And I think a great reference for that, and Kim, you can add this to the chat box, is the Environmental Working Group. What they have is kind of their Clean 15 and their Dirty Dozen. There's actually a few more than the Dirty Dozen now, but the Clean 15 are their top 15 fruits and vegetables that they consider, like blueberries is one of them, like they consider to be not as high of a risk in terms of pesticides. And then the Dirty Dozen, things like strawberries, can tend to have higher pesticide residues, or apples. So, you know, those might be ones that if you do have a slight budget to afford organic, that might make more sense. So I always think that that's a great place to start if you're interested in doing that change, making that change, because you know you're spending your money wisely based on, you know, what we actually know, rather than kind of just shooting in the dark and kind of picking up organic on a package whenever you see it. So that's a really great place to start. And of course, always enlist the help of your dietitian if you need more assistance in that kind of, you know, in choosing, you know, good organic foods that are appropriate for you.
Okay, and you mentioned, so we've mentioned a dietitian, we mentioned a nutritionist. Is there actually a difference, like when patients go in to ask their healthcare team about somebody, is there a difference between the two?
Oh yeah, actually there is, and I'm glad you brought that up because I wanted to mention that. A registered dietitian has been credentialed by the Academy of Nutrition and Dietetics, and it's gone through an internship, or like kind of like a residency, has sat for an exam. You know, it's a pretty strict credential, very well-respected field. Whereas a nutritionist, all dietitians are nutritionists by trade because obviously we've studied nutrition, but nutritionist is not a regulated term. So your neighbor can go outside, hang a shingle on their, you know, on their mailbox saying, nutritionist, I'm a nutritionist, come in for visits, and they wouldn't get in trouble because they may not have any training, but they can call themselves that because it's not regulated. So it's always very, very important when you do seek nutritional advice, especially as a cancer survivor, always make sure that you seek it from a registered dietitian, somebody with an RD credential after their name. And that's how you know you're getting, you know, somebody who has had the training to give you the appropriate advice.
No, I think that's excellent advice. And then lastly, you have a lot of references listed here. Is there one or two places that you could suggest to folks to go if they're looking kind of for tips on good recipes that they could use at home to make sure that they're you know, eating all the appropriate foods? Are there a couple of go-to resources that you use?
Oh, for sure, yeah, definitely. I mentioned the American Institute for Cancer Research a lot, and that they have a phenomenal website for, you know, in terms of cancer survivorship, cancer prevention, preventing recurrence. You can sign up for weekly recipes. They have all of the evidence-based information on there, some great booklets, and we actually even worked with the American Institute for Cancer Research. So Meals to Heal worked with Livestrong Foundation and the American Institute for Cancer Research to formulate a nutrition guide, which you can download from any of our websites, that gives you everything and anything you ever need to know you know, in terms of nutrition before, during, and after cancer treatment. So I would say definitely ASCR is a great resource, and obviously Livestrong as well. And I've already mentioned in Meals to Heal, we have a ton of great evidence-based information on our website. We put weekly blogs and recipes and all that stuff. So, you know, definitely if you're going to try to, you know, search for something on the internet, make sure you're getting it from a reputable source, and I think that's the key to finding the appropriate information and evidence. Generally speaking, for the most part, .org, .gov, you know, rather than, you know, I know there's, you know, some crazy websites out there. There may be something called, you know, cure colorectal cancer with, you know, such and such supplement.com, you know, and then obviously, you know, that's not a reputable. So look for the red flags, you know, obviously things that seem too good to be true probably are too good to be true, and always make sure to go to the reputable sources first before you make a decision to kind of try something that seems like new and different and you know, the latest and greatest in terms of cancer prevention. So those would be my top choices.
Okay, great. Yeah, that's actually something we recommend to people too, to make sure and know that you're at a trusted source. So we here at colorectalcancer.org, we are a trusted source that's here for you. So if you have any questions, please be sure and reach out to us. We got either via the presentation or via the Q&A. We got most of the questions, although we'll take the ostomy and the ileostomy questions to a completely separate webinar, so stay tuned. And if we didn't get to your question today, just stay tuned. We'll be sure and circle back and use Jessica's expertise and get you an answer. So on behalf of Fight Colorectal Cancer, I just want to say thank you so much for participating in our monthly patient webinar series. We do have them every month. You can go to our website at fightcolorectalcancer.org and print out a calendar of them for the remainder of the year. And like I said, they're always archived on our website. So if you can't participate live, you can find it archived on our site there at fightcolorectalcancer.org /webinars. So thank you so much for your attendance. And Jessica, thank you to you for your expertise and for our IT people on the phone too. And I hope everybody has a great afternoon. Take care.